The Hospital University of HUS is facing a financial crisis. Rising costs and shrinking reimbursements have taken their toll. Like a patient in the ICU, the situation is critical. The alarm bells are ringing, but will anyone answer the call? The pandemic stretched resources thin. Elective procedures were put on hold. Now HUS is grappling with the aftershocks. Inflation is soaring, adding fuel to the fire. Every supply costs more. Salaries haven't kept pace. HUS is spending more than it's taking in. This isn't just about numbers, it's about people. Nurses and doctors working tirelessly, and patients relying on HUS for their well-being. Faced with a projected deficit of insert projected deficit here, HUS administrators made a painful decision: layoffs. The cuts are deep, affecting every department from surgery to housekeeping. Nurses, technicians, even support staff. No one is immune. The administration argues it's a necessary evil, a last resort to stop the bleeding. They claim the layoffs will streamline operations and reduce overhead, but at what cost? Critics argue that the layoffs are short-sighted and counterproductive. They say that cutting staff will only worsen patient care and drive up costs in the long run. The debate is fierce, with both sides entrenched in their positions. One thing is clear: the layoffs have created a climate of fear and uncertainty at HUS. Morale is at an all-time low. The people who dedicate their lives to healing are now worried about their own futures. The impact of the layoffs is already being felt throughout the hospital. Wait times in the ER are longer, surgeries are being delayed, patients are reporting feeling rushed and neglected. The remaining staff is stretched thin, forced to do more with less. They are burning out, their own health and well-being suffering. They joined the medical profession to care for others, not to watch the system crumble around them. The quality of care, once a point of pride for HUS, is now in jeopardy. Errors are more likely when staff is overworked and under pressure. The very people HUS is trying to save may end up paying the ultimate price. The layoffs are a stark reminder that healthcare is more than just a business. It's a fundamental human right. When we commodify healthcare, treating it like any other industry, we all lose. The announcement of the layoffs has been met with outrage and disbelief. Healthcare professionals, union representatives and community members have all voiced their opposition. Protests have erupted, demanding a reversal of the decision. Nurses argue that the layoffs will lead to unsafe staffing ratios, putting patients at risk. They warn of an exodus of experienced nurses, further exacerbating the crisis. Union leaders accuse the administration of prioritizing profits over people. They demand transparency and accountability, calling for a full audit of the hospital's finances. The layoffs at HUS are a symptom of a much larger problem: the unsustainable state of our healthcare system. When hospitals choose between financial stability and patient care, something is deeply wrong. The consequences will be felt far beyond HUS. They erode trust, discourage future doctors, and jeopardize our health. The human cost cannot be overstated. Behind statistics are real people, patients, families, and professionals. It's time for a national conversation about healthcare's future. The crisis at HUS is a wake-up call. We can no longer ignore the systemic problems plaguing our healthcare system. Layoffs are not a solution. They are a band-aid on a gaping wound. Instead of cutting staff, HUS should explore alternative cost-saving measures. Negotiating better rates with insurance companies, reducing administrative waste, and investing in preventative care are just a few examples. The government also has a role to play. Increased funding for public hospitals, reforms to lower drug prices, and a focus on preventative care are all essential to creating a more sustainable healthcare system. This is not an insurmountable challenge. Other countries have managed to provide high-quality, affordable healthcare to their citizens. We can learn from their successes and adapt their models to fit our unique needs. The situation at HUS highlights a fundamental tension in our healthcare system, the balance between financial responsibility and our moral obligation to provide care for those in need. We cannot allow hospitals to become driven solely by profit margins. Healthcare is not a commodity, it is a fundamental human right. We must find a way to reconcile these competing interests and create a system that works for everyone. This will require a collective effort from hospitals, policymakers, insurance companies, and the public. We must demand transparency, accountability, and a commitment to putting patients first. The future of healthcare is in our hands. Let us choose compassion over cuts and ensure that everyone has access to the care they need, regardless of their ability to pay. The time to act is now.